Thank you very much, Fabrizio. Good afternoon, everybody. I just said that I was, but I'll say it again. I'm Dr. Ruth Patterson. I am Interim Dean at the School of Health and Social Care at Edinburgh Napier University and Chair of the Innovation and Pedagogy Group at the Council of Deans. So a warm welcome to everybody who's joined this webinar this afternoon. And this webinar is entitled Post-Pandemic Progress Case Studies from the Report. And it's really part of a series of events and write-ups planned for Innovation Month. So please see the Council website for any and social media pages so you don't miss out on any of the other events that we've got showcased this month. This webinar marks almost 2 years since the Council published the Pandemic Powered Improvement Report, which showcased innovative healthcare placements implemented by universities across the UK. And that was really in response to the challenges of the COVID-19 pandemic. So out of a crisis, we had we created innovation. As a follow-up, the Council published a report last week, Post-Pandemic Progress, Lessons Learned in Healthcare Education, which really seeks to explore the lessons learned from these placements as HEI's transition to a post-pandemic phase of learning. In this webinar, our speakers will showcase notable examples of these placements and discuss how these have progressed since the original report, any challenges they've faced and lessons learned as a result. There'll be an opportunity to share best practice and innovative practice placements and serve as a springboard for further innovation in the healthcare education sector. I'm delighted to introduce our two speakers for this session, Dr. Lisa Taylor, who led on the peer-enhanced e-placement model, and Anita Volkart, who will be discussing the Near Peer project. So just for some housekeeping before we start, there will be designated time for questions at the end, and we ask that you please use the Q&A function at the bottom of your screen for questions. Also, feel free to use the chat to introduce yourself and make any comments. However, please do ask questions in the Q&A. Lastly, this session will be recorded and posted on the Council's YouTube channel, and the speaker's slides will be shared with our attendees after the session. So, without further ado, I'll pass over to our first speaker, Anita Volkart.
Thank you very much, Ruth, and it's a pleasure to be here today. And thanks for sharing the slides, Fabrizio. If you could pop them into presenter mode for me, slideshow mode, yeah. I think we're just going to move through and pick up. Yeah, that's great. Okay, so I was delighted to be asked to come along and give an update on the Near Peer pilot project in occupational therapy that we instigated at Glasgow Caledonian University during the pandemic with the funds that we received from Scottish Government to enable us to grow placement capacity. My name's Anita Volkart, as Ruth said, but I'd also like to really thank our occupational therapy placement team at Glasgow Caledonian, our students who participated, and our wonderful practice educators from NHS Ayrshire and Arran and NHS Lanarkshire who implemented the project in summer 2022. So moving on to the next slide, Fabrizio, thank you. Okay, so just what it was, we're the third case study in the report, and this was a 2-to-1, so 2 students to 1 educator, near peer assisted learning placement model. And we piloted it with 2 NHS boards in Scotland during summer 2022. And I've just put a little graphic up to kind of, we didn't have as many students as this, but this is kind of how far you could go with near peer, and some of the other pilots I've worked with in the past have used it in this way. So you have a practice educator at the top. You have your senior students who usually are maybe master's level 2 or bachelor's level 3 or 4. And then you have some junior students who are usually bachelor's 1 or 2 or master's year 1. And all of those students are supporting each other. So looking at what peer-assisted learning is and what near peer-assisted learning is, peer-assisted learning is really just a method of peer-to-peer learning. So students support other students to learn. It's participatory and it's really focused on collaborative working. So when we use it, we put 2 or more students together with 1 or more educators, and the crucial thing is the students learn together and from and with each other. Students can be at the same level of study, that's just standard peer-assisted learning, or they could be different levels, and that's near peer-assisted learning. The idea being that a student just a step or two above another one has really vital things that they can teach another student. And it's designed so students learn with and from each other. So learning activities could include, but aren't limited to, working with service users directly, so doing clinical work, briefing or debriefing each other before or after a student takes responsibility for something, critical reflection, and completing project and research work. So moving on. So the benefits are around increase of confidence and boosting of resilience, which I think is super important in our current climate. And that's really one of the things that's been found from peer-assisted learning and near-peer learning. It helps students find solutions to problems and provides emotional support that they don't get in the same way from qualified staff who are assessing them. So it's a different relationship. There is actually quite a strong evidence base for it. That's great. Across allied health, but more with nursing and medical student education, actually. So I think we could do more research in allied health around this. And it really helps students become more receptive to learning, learn from each other, collaborate. It helps them organise and plan and take responsibility, step up to responsibility. They evaluate and reflect on their own learning and learn to give and receive feedback. Super important workplace skills. It fosters a culture of community, develops those soft communication skills, which are so important in today's working world. So we really think it helped prepare a workforce for the future. And when well designed, it can reduce educator burden. And that's some of the feedback we had. So moving on. So a general overview of our project. It was initiated at the height of the pandemic, when we had extremely limited or no offers from our statutory and usual providers. And we rolled out the project over the subsequent 18 months to 2 years. And we subdivided the students into little teams or pairs. They worked quite closely with each other, but they also had an absolute minimum of daily contact with their educator, morning check-in, afternoon check-out. And most of the students had more than that, actually. We really encouraged the students to solve problems themselves, use each other, and use the other resources available to them. And they had supervision together weekly. We did insist, and it is, I think, good practice for students to have their assessment individually, though. We also provided some support to the practice educators as a HEI. So we offered some preparation and support sessions, and we also offered weekly drop-ins with our educators throughout. And they really appreciated that, actually, because it was quite a new model. Moving on. So challenges can occur with near-peer learning, particularly when you have students with very different learning styles. So say, I mean, a little bit contested is the whole idea of learning styles, but you know, if you have a very sort of activist experiential student and a very theoretical reflective student, you know, their learning styles can be really quite different, and that can clash. And I think that's where the skill of an educator and your HEI staff to help students see that they could actually learn from each other with those different styles. Likewise, the different knowledge levels. That's actually what we're trying to do in near-peer learning, is pair students with different knowledge levels so that they can exchange those knowledge levels. But it's a skill to pass knowledge on and something that the students need to work on. There is issues around competition or being felt as if intimidating. So again, it's about the development of those communication skills and those team working skills in students. And it may be that educator time and expertise is needed to deal with those issues and to design the placement with care and assess students and really give them some valuable feedback, both about the clinical work they might be doing, but about the near-peer work as well. We did need, and still do need, a bit of mass culture change, particularly in the occupational therapy profession, because peer-assisted learning hasn't been the norm in our profession. It's a one-to-one apprenticeship model style that most placements run on still. And we had to deal with all of these challenges in our pilot, and we really primarily used our HEI drop-ins with the practice educators to work through these issues. Moving on. So the feedback we received, students asked for more peer learning. It's a very, the team working element and the popularity of the placement was very high with students. They really, really liked the support. Even though there were challenges, And it wasn't always smooth sailing. The students really liked the feel of that support and learning from each other. Our educators told us they had increased confidence in new model practice-based learning, which this was for them, and it is a new model in the AHPs, and their confidence had been low to try those things out. They also fed back that it was really rewarding, just fantastic to see the skills the students developed around team working and around communication and around being able to give and receive that feedback and rise to those challenges. And they really liked the fact that the placement stressed work readiness skills. So things like managing an online platform, because some of the placements had partial remote element to them. And so students were meeting across teams, like or a little bit like we're doing today, managing their own time, actually producing things together that they had to project work and being responsible for themselves and other people. So moving on. Ongoing implementation. So we ran the project out in, so we did a lot of pre-planning and pre-preparation, and then we ran the project in 2022. So now it's 2024, and what's happened? So we do have small pockets of champions, and they continue, particularly in our third sector, but also in our statutory sector, to be interested and to be wanting to continue this project and trying it out, and continuing to take peers, pairs, near peers. We have had increasing interest from particularly the statutory sector, which is great, in interprofessional near-peer and peer-based practice learning. And interprofessional, I think, is a really great area for us to explore going into the future. And that's including international placements, and we've also been approached internationally for requests to mentor other universities from international locations in piloting a similar project. The approach remains very popular with students. We get a lot of requests from students who have heard that it happens and would like to try it themselves. And what I'm anticipating and what I have seen before with near-peer pilots I've done in other parts of the world is that as the students who experience this graduate, it becomes the norm. It becomes something that they then offer, because for them, that's what they experienced. It is normal. And so that helps us with that culture change. We have had to face some challenges. So there's a bit of a back to normal approach, I think, post-COVID. So some of the innovations we put into place, there's a kind of perception that we don't need some of them anymore. I think we still do. So it's about kind of addressing that and back to normal idea. But our workforce is also quite depleted after COVID. Quite a few people have moved on out of the health professions, and we have some recruitment issues at the moment, which I'm sure people are aware of. So we do have a depleted workforce, which always makes it a little bit harder. And our current fiscal climate is challenging right across the sector, in education and in health. And so there isn't much additional resourcing to help us implement further. So we've been able to kind of hold to some degree, but our push forward is slower than really we would like it to be fairly honest. But we do have the interest, we have the enthusiasm, we have the motivation, and we have our group of students coming through to change. Moving on. So the key messages are that near-peer assisted learning isn't about just asking educators to do twice as much work, which I think is often what people think when they hear it. It can actually reduce workload, and it has many benefits that enhance student experience and learning. And it may be a model that really helps our students prepare much more effectively for future health and social care work, you know, as we see our changing health landscape ahead of us. And since our initial forays into near-peer assisted learning, we've seen this model successfully piloted and taken up, and it's already a model we have seen really picked up and adopted in our third sector areas as well. So I think that's it from me, just a page of references now. And I will hand over to Lisa, who I hope has got some good connection now so that she can give her piece. Thank you so much, everyone.
So hopefully everybody can hear me okay. Brilliant, thank you. So I'm Professor Lisa Taylor, and I'm here to share the experiences around the Peer Enhanced E-Placement PEEP model, which was originally created as an emergency response, but is now a sustainable placement model for health professions. Next slide, please. Before I start, I'd like to just acknowledge some really important people who have helped really with the transformation of PEEP over the last 4 years. Professor Julie Salmon and myself have worked together to develop and share the PEEP model, but there's also been, similar to the previous speaker, about having champions. There have been certain champions who have really sort of taken the PEEP on and developed it themselves. So thank you to all of those teams who have adopted the PEEP and continue to champion the PEEP model. Next slide, please. So as I said, the PEEP was originally developed as a response to COVID suspended placements. Our occupational therapy second year students needed a placement. They didn't have their usual in-person, in-place placements available, but needed to have that placement learning opportunity to progress their courses. So I created the original PEEP, which was built very much around the learning outcomes, the usual learning outcomes for their placements, because those learning outcomes are what the existing courses and the existing placement standards, etc., are validated against. But what we realised is that it didn't just have to have the anchors of the learning outcomes, but there needed to be an evidence-based approach pedagogically for the students, because the placement was going to be delivered quite differently online and in peer groups. So we very much used the online evidence-based literature that predominantly developed by Professor Julie Salmon, and peer group learning pedagogy, which has always been in the literature, but is now starting to really get traction within higher education. So the original pioneering PEEP was the catalyst for reimagination of placement provision, and it has been developed since to maximise its quality and pedagogical robustness. And it has now got that sustainability as a placement model, in the fact that we're now able to have live links into the placement environments to have that telehealth representation for students. And it is now recognised by professional and statutory bodies, has been a case study for Erasmus Plus higher education research project as well. Next slide, please. So the 3 core components of a PEEP are those professional standards and specific placement learning outcomes, which are really the anchors that really make sure that you don't drift off in the way that you're delivering your PEEP, that you're remaining sure to the original learning that needs to be achieved from that placement. There are those PEEP pedagogical principles and timetable design that really underpin that learning journey for the students. And then you have your online placement environment using the usual virtual learning environments or learning management systems or other technology platforms such as Zoom or MS Teams. Next slide, please. So when we'd done the original PEEP and realised actually the feedback was really positive from both the staff involved in its delivery, but also the students, we realised we were onto something that could be beneficial for others to learn to adopt. So Julie and myself developed an online synchronous PEEP acquisition experience workshop. We piloted it and found actually it was really useful for those that we piloted it with. So what we've done is develop that PEEP acquisition workshop to really help those placement teams to work collaboratively in the design and delivery of their own PEEPs, to have that understanding of the robust pedagogical principles and the transferability of the PEEP to support that contextualisation at a local level. Everybody's going to have the different local needs for their students and also slightly different learning outcomes. So each PEEP does need to be designed and created at a local level to make sure there's maximum potential for the student learning. Next slide, please. So we've worked with several teams over the last 4 years, and you'll see some of the stats for that later when I talk about the reach and impact. And we are now getting some examples of evaluated PEEPs independent of our own research. We've conducted our own research, which has shown really positive results. But I thought it'd be interesting just to show a range of evaluated PEEPs that we've had across different professions. So an occupational therapy PEEP in the north east of England has been carried out for students, and the in-depth understanding was really positive in the fact that they're now trying to embed that within their ongoing programme provision. That was a PEEP that was developed by the Higher Education Institute themselves, whereas the next one, the Orthoptist PEEP, was delivered by an NHS trust in Yorkshire. They had really positive evaluation And the orthoptist profession is one of the smaller professions of the AHP family, and they do sometimes struggle with getting placements. And so what they did then was they completed a subsequent PEEP with students in Scotland. So it was a joint England and Scotland PEEP that again was delivered entirely by the NHS Trust. Then there's an example of a physiotherapy PEEP evaluation in Scotland as well with first year students, and they said it was effective to provide physiotherapy students with that initial experience of practice-based learning. And then we've got some more recent ones around nursing PEEP projects. There's two examples, one in Buckinghamshire New University. They carried out an initial PEEP with really positive results, and then they've done a subsequent PEEP that has been across 5 universities and 3 mental health practice learning providers, so really spanning the ICS across there. And then there's Kingston University London, who created the first cross-field PEEP with those student nurses who were from children and young people's nursing and learning disability student nurses as well, completed their PEEP together. And so the positive evaluation from that as well means that they have now got plans for that to be implemented for more students in 2025. And then that's going to be compulsory for children's nursing and learning disability nursing students from then onwards. And those individual PEEP projects were actually shortlisted for 3 Student Nursing Times Awards this year. Next slide, please. And then the final example is a national project that Julie and I led, where we looked at contextualising the PEEP for the operating department practitioner profession. So it was a national project. We worked with everybody across the ODP profession, including the College of ODPs, as well as practitioners and students. And that was really successful in that profession being able to adapt the PEEP for their own use in what is predominantly an in-person, in-place placement model, but actually they've found the learning that can be achieved by the ODPs, next slide please, can really benefit the ODP students as well. So within 6 months of the project, 175 PEEPs were delivered, and there was really positive feedback, and that's going to be embedded going onwards as well. Next slide, please. So when we're talking about the reach and the impact of the PEEP, sort of fast forwarding those 4 years where we've had our initial PEEP, but also then conducting our own research on PEEPs that have been implemented, but also seeing these other wider evaluated PEEPs across different professions. It's interesting just to see what the reach and impact of the PEEP has been over those 4 years. So we have worked with over 80 placement teams, and that spans over 20 professions or fields. We know of over 2,000 students formally recorded as having completed PEEP to date, but we know there's many more than that we're not aware of. We've completed research on the PEEP acquisition experience and completed PEEPs, and that has been very positive, the results of those. And also we've now got PEEP examples across all of these different professions: occupational therapy, diagnostic radiography, orthoptists, speech and language therapy, nursing, physiotherapy, operating department practitioners and dietetics. And it has been positively evaluated across many health and social care professions, offering a quality, sustainable, collaborative, evidence-based, authentic placement option for students to use. We've been involved in multiple conference presentations, publications and awards, and you can see from the images below the text, we've won several awards and it's been very much used in advising other people about how to deliver online placements, used as that case study for an Erasmus Plus project as well. Next slide, please. I was approached by Routledge to write a book based on the principles, the design and delivery principles of the PEEP. Because the PEEP might have been created initially for health professions, the principles around the design and delivery of a PEEP can very much be translated across the higher education sector. So I wrote a book on constructing online work-based learning placements, which have been based on the PEEP. And then there's a couple of pieces of sort of hot off the press news that I added at the last minute. We have got a contract confirmed with NHS England. I talked about the PEEP acquisition experience earlier, which is a half-day synchronous online workshop that Julie and I have led. But what we're going to do is translate that content from the existing synchronous online PEEP acquisition experience into an asynchronous online on-demand e-learning for healthcare programme, and that's going to be developed over the coming months. And also PEEP has been recommended within the recently published Higher Education Policy Connect Digitally Enhanced Blended Learning Report, which is a sort of sector-wide organisation that advises higher education about different directions that higher education should be going into in order to support student learning, and PEEP was highlighted as a case study that should be an exemplar that could be adopted across the higher education landscape. Next slide, please. So there have been challenges as well as benefits. There's a bit of sort of cost benefit balancing going here, as with the previous presenter, Anita, as well, that the culture change. Yes, there's been a huge shift in culture over the last 4 years about how online learning can be really beneficial, but there still needs to be that culture change to really appreciate what benefits can be achieved. There does need to be online access, and there does need to be time to plan and deliver the PEEP. If it's designed well initially, then it can be repeated time and time again with subsequent cohorts with minor changes. But the benefits are travel accommodation costs are saved, time saving, sustainability, both from an environmental point of view, but also the sustainability of the model to be repeated without any worries about any capacity problems, because it is designed and whole cohorts of students can be addressed at the same time. Helps with student well-being. It's emotional and physical cost to students travelling, and the emotional transition of going on placement. There are learning gains and those guaranteed placement capacity gains. Quality assurance as well. Sometimes placements don't always deliver what students are expecting, but the way that the PEEP can be designed and delivered very specifically, every student will be getting the same experience and quality learning. And it's had that opportunity to prepare the future workforce in the telehealth principles, but also some of the content of the PEEP can be designed to prepare students for future potential working environments. Next slide, please. So the key messages and lessons learned are alternative models of placement can complement in-place, in-person clinical placement models. There does need to be that shift in mindset to appreciate valuable learning that can be achieved through online placement learning, particularly around teamwork and in-depth clinical and professional reasoning that's come up time and time again in the various evaluations. It's a pedagogically robust design and delivery principles that the PEEP uses, and they're essential and absolutely need to be built around the learning outcomes, which are based on those professional body statutory placement standard requirements. Additional in-depth learning gains can be achieved online compared to face-to-face in-person placements, and it's been adopted and positively evaluated across many health and social care professions now, offering that quality, sustainable, collaborative, flexible, evidence-based, authentic placement option to prepare students for future workforce needs, whilst also assisting with ongoing placement capacity challenges I'm sure we're all aware of. Next slide, please. So in conclusion, PEEP offers a sustainable mitigation against further disruption and placement capacity challenges. It really offers enhanced learning around non-hands-on employability professional development gains for students, but staff who've been involved in delivering the PEEP have said that they've found it really useful as well to help their individual development. And there's a quality, robust design and evidence-based underpinning the PEEP design and delivery principles, which are very much built around those learning outcome anchors that our students would be expecting to be learning anyway. But it has that flexibility for local adaptation and adoption for local need, with a breadth of bespoke learning opportunities. Next slide, please. So I've put here lots of references and a bibliography of all of the evidence that we've sort of gathered and underpinning evidence around the PEEP. And the next slide, please. And then there's a raft of resources that we've built up over the last few years as well, if people are wanting to look into it a little bit more. Next slide, please. And then thank you very much for listening, and I will hand back to Ruth. Thank you.
Yeah, thank you both. What excellent projects these are. What I heard there was, the real growth of your project, Lisa, in terms of the reach that you've now got with PEEP and the sort of real traction that you've really secured on that, which is really excellent. And from yourself, Anita, it was about the sort of real benefit of team working and interprofessional sort of collaboration during a time where people were feeling quite isolated in their development of practice. So congratulations to you both. They sound like absolutely fantastic projects, and well done for the presentations. There are some questions in the chat. What I might do first of all is just open it up to the floor just for additional questions, but I'll start off with some of the questions that are there first of all. So we've got a comment from Nolene Ryan. I don't know whether Nolene's still on the call, but she's just said peer-assisted learning is used as a model in dietetics at the University of Chester for first-year placement, and it's well received and delivered. I guess, Anita, the question that I would have is that has it been rolled out across other professions other than occupational therapy?
Yeah, that's a great question, and thanks so much for making that point about dietetics from the participant there. Because I think that peer-assisted learning does have better traction, like going into the pandemic had better traction from some of our other professions like dietetics, like speech and language therapy, for example. And what we were able to do during the pandemic was learn from those professions about what had worked for them and start to place students from professions who historically didn't use those approaches, like occupational therapy, and for us like podiatry, which had a really good uptake of both peer and near peer placements during this period as well, during a time when they certainly found it incredibly challenging to get placements. So yeah, absolutely. We saw that movement out with occupational therapy, and we were able to learn from some of the other professions. Our physio team were able to place 6 students with 1 educator in intensive care. They were also using digital methods to help them do that, but that was an amazing achievement, and we were just thrilled to bits with that. So we really did see it blossom during that period, and as I say, it has contracted back a little bit now, but I don't think we haven't lost the movement, and certainly are able to keep expanding out.
We consider the sort of demand for health education students over the next 5 to 10 years, we really do need to look at placement capacity and really high quality placement capacity as well. So it sounds like this may well be a solution to that. Thanks, Anita. And Claire Headley's got a question just in relation to, interested in how you think we can support teams to embrace the near peer model, breaking down the barrier that is extra work and moving away from our one-to-one model in OT. So how do we change the culture, I guess, with this?
And thank you, Claire, for that question. And of course, you are fairly local to me in Glasgow, so I'd be very, very happy to work with you on that. And I think, culture change is difficult and change is slow. And I think the more champions, and Lisa talked about champions too, the more we have the pockets of champions who are able to say, oh, look, I'm doing this and it's really working for me really effectively. And it isn't more work, it's actually less work, which is what a lot of our near peer educators found. And they didn't really think that would happen. And when it did, they were really surprised. And, I'm seeing all these additional outcomes that the students are getting that they wouldn't get on a traditional one-to-one placement. So it's seeing those benefits and having people say, it's working for me. And I think having some converted people saying it's working for me, people saying, yeah, I thought it would be twice as much work as well, but actually I found it wasn't. So I think that those pockets of champions really help. And as I said in the presentation, the time lag between the students who are experiencing this now to when they become practice educators, that was something I didn't expect. And where I did near peer first was in Sydney. And it was very challenging. We had to really expand our placement capacity quickly with the advent of several new universities all at the same time with large cohorts. And we didn't anticipate that would be in a step down the track. And when that happened, our lives just suddenly became so much easier, because we just had all these students saying, oh, ex students who were now educators saying, oh, well, of course I'll take 2 students or 4 students. That's what I did. It was normal. Yeah. So I think we will see that turning tide as well. Yeah.
Quite transformational. Lisa, do you have anything to add? Because I guess you've built quite an evidence base around this.
Yeah, I agree with the sort of culture change as well. It is about people looking over their shoulders and seeing what other people have done and thought, oh, you know, they've dared to dip their toe in the water and have found that they've found, but let's give it a go. It's almost, yeah, I applaud those people who have sort of gone with it and run with it. And then, yeah, it's a brave thing to do. We were forced into it initially, and then found these things that were really, really beneficial. And so it is just capturing those people who are going to be those champions, I think, to help with that culture change, because I think it does need to be a bit of a drip feed approach. I don't think people can quite believe what can be achieved with different models of placement. And, you know, the peer assisted learning or the near peer learning is one example of that. The PEEP is another example of that, where you're not only working in peer groups, they're of the same level, so they're working towards learning outcomes together. You've also got the added culture change of it being delivered entirely online. And, you know, so there's 2 elements there. Is, you know, that appreciation of peer group learning can be so rich. You know, the challenging they do within their peer groups, I'm not sure that individuals or pairs would challenge their educators or supervisors in practice the way that they challenge each other. And I think that's where that real in-depth, critical, analytical and sort of professional reasoning comes in, that we're getting time and time from all the evaluations. So culture change is crucial, and having the sort of champions is really important for that. But I think that sort of recognition of the learning that can be achieved in those non-traditional ways, I think, is the most difficult thing for people to really believe. They sometimes feel it's too good to be true, you know, that you can put a whole cohort through a placement on a PEEP and they still all individually get rich learning from that would be equivalent to what they may be able to get in the physical environment, apart from that literal hands-on clinical skills. So yeah, I think it does boil down to that culture change, really.
So sort of sticking with the practice educators and sort of thinking about them, how have you both gone about upskilling staff and delivering these new methods? You know, you've got your champions, those people that are bought into it, but sort of how, you know, you both mentioned how you'd upskilled the staff or sort of informed the staff about how, or the practice educators, how to sort of deliver this model. Have you got any examples of where it worked well or where it didn't work so well, and the challenges that you had with that?
Okay. Do you want to go in, Lisa, and I'll come in
you
after
go first if you want, Anita. Yeah.
Okay. So one of the things that we did was both the drop-in sessions that I talked about, which was sort of ongoing support, which I think were really helpful. But we also did a sort of manual. It was short, so it wasn't, you know, too long for people to have to work through. But it was something kind of, obviously it was electronic, but it was something sort of almost physical hard copy that people could think, oh, I run into a bit of a problem, I'll just look at the manual, and which was kind of nicely laid out with FAQs and things like that. And it sort of gave people, I think, a sense of security, actually, around the skills that they already had that they could use in this new context. And I really think that's probably how practice educators, that's actually what practice educators need to do, is really be thinking, well, actually, we have a whole lot of skills, because if you're someone who takes students, if you're a health professional anyway, you have all those communication skills and process skills and problem solving skills and lateral thinking skills anyway that you use in your clinical practice. And it's kind of applying those in that learning situation with a student, and then thinking about how you deal with change and new things in your workplace and your clinical practice all the time, and you use your existing knowledge to apply that new knowledge. So helping people kind of make that bridge and feel confident to do it, I think. But the physical sort of handbook, which kind of detailed the placement and gave the FAQs, I think was really supportive to people, as were the drop-ins. So people have come along and just say, oh no, this has happened with competition between the students. What do I do? And whilst we didn't have, pat answers for that, we were a group of people who could then say, well, we could try this, and have you tried that? And I tried this. And yeah, so it was just really helpful, I think, that ongoing support. So I think in terms of upskilling, I probably wouldn't describe it as upskilling, actually. I'd probably describe it as realization of existing skills and how to use them in a different context. Yeah.
And from the PEAP point of view, I sort of spoke briefly about the PEAP acquisition experience, which is the half-day synchronous online workshop that Gillian and I put together, which was for the very reasons of offering that support and guidance to placement teams. So placement teams involved everybody who's going to be involved in the delivery of the placements. That includes the educators and supervisors, as well as higher education staff, service users, experts by experience. Whoever was going to be involved in the placement would come together and work together as a team to learn about the evidence base that underpins it, to then arm them with that knowledge and understanding to then be able to design and deliver their own PEAPs. And so the second half of the workshop, we dissect the standard timetable, and then they start to populate it with their own content. And there's a sort of flipped approach where they have to do a bit of prep work in deciding which placement is it that they're going to slot the PEAP into. So they come with their learning outcomes. So then that second part of the workshop is very authentic, and they're starting to really start to adopt and adapt the PEAP for themselves. So that it's similar to you, Anita. There's a student e-handbook I put together for the students. But now we've got additional comments and suggestions as to whoever is designing, delivering their PEAP. This is what you need to think about, and this is what you need to be doing. And as I said, we're now going to be translating that into an on-demand, online, asynchronous activity on the e-learning for healthcare, so that then it's more accessible to everybody in the coming months.
Yeah, excellent. Thank you very much. So during the pandemic, I don't know about your university, but I think across the country, there was a real sort of element of digital inequality, let's just say, in terms of what people had access to the internet in remote and rural areas, and all these inequalities that we actually found. And now we're going into a phase of fiscal restrictions, really, about what we can do in terms of resources, and that filters down from the universities right down to our student population. During the pandemic, is there anything that we can learn from the digital challenges that you had using these models that we can now start to learn from and build on for the future challenges that we've got ahead in higher education? I don't know. Lisa, do you want to go first, or?
Yeah, I'm just thinking about that, because the way that we designed it, we used existing virtual learning environment, which all of our students would ordinarily have access to. So I suppose that's the learning, is that don't introduce anything too technological. So the robustness of the PEAP is not in the whizzy bangy technology that you can use. It's in the robust pedagogical principles and evidence-based approach to it. It doesn't need to be complicated to have really rich learning. And so I suppose that would be my advice, is just as you want to anchor yourself to your learning outcomes, you want to anchor any design and delivery on what students already have access to, so that you're not then going to be disadvantaging any students who might not have that access to anything digital that could be more than what they're already having access to within their usual programs anyway.
Anita, anything else?
Yeah, I think I do absolutely agree with that. I think working within your existing resource capacity, whilst having an eye for the future and thinking about where's that direction going, but certainly working within what you have available at your fingertips is a really good idea. And we deliberately, we were working with the NHS, and there are IT governance issues around what platforms you can use. So we worked within the constraints of what our NHS boards were working with at the time. During the pandemic, Glasgow is obviously, was well known to be a socially deprived part of the UK, and so our students face particular challenges around accessing equipment and devices and internet access, high-speed internet accesses and things like that. And we did run a scheme for students to be able to access some funding for equipment during that period of time. Many of our students were reduced to using their mobile phones, like writing essays on their mobile phones, because normally they were borrowing laptops from our library, and when the library wasn't open, they couldn't do that. So we did look at we did run schemes like that through our university, and I think whilst we are facing a resource challenging time ahead, I think it is wise for us all to be thinking about how we spread that resourcing across into areas and into locations where people are less likely to have access to resources, if that makes sense. But yeah, using what we have. And I also, with any digital method, always deliberately go as low broadband as possible, if that makes sense. So we're using Zoom today, and Zoom is a great platform. Obviously other platforms are available, but Zoom is a great platform for students who are remotely tuning in from a placement site or something like that to an HEI, because it's they can run it off a mobile phone pretty easily on a mobile connection, whereas some of the other platforms are much heavier, harder with the data, that kind of thing. So yeah, we learned some things like that, I think, along the way to help that equality and accessibility.
And I think that's a really excellent point in terms of, you know, using what we've got. And you know, it might not be the absolute 100% ideal all singing, all dancing platform or all singing, all dancing resource, but if it meets the needs of the students, and I guess in terms of student experience, if it sort of provides a good enough student experience to allow the students to progress in their programs, I think that's a really, you know, a key point, a key take-home message from this this webinar. I suppose that brings me to my sort of last question that I have, which is one from me. So I'll wait and see if there's anybody else that's going to post a question. But I just got one question, which is around student experience. You know, we all live and die by the sword of the NSS, and you know, it's just about, you know, the overall student experience during this time was in some ways very positive for the students, but in terms of these models, I mean, what's your sort of sense of the overall student experience of this? Obviously you're carrying it on, so it must be positive, but have you got any sort of specific examples of where this has been, you know, particularly flying the flag for these particular models?
I think with any new model, just like there needs to be culture change with the staff involved in the delivery, the students needed a bit of culture change as well, as to, again, not feel as though their placements have to be hands-on, in person, in place. So that's been something that has needed navigation, I think, for the students to really appreciate that. And actually there's been a lot of conversion of students who might have started a bit cynically, but actually by the end could actually see what their learning had been, and how rich that could be. The other thing about the sort of positive aspects of the different models is it was really refreshing for us to hear from the students from that initial peep. I tried to create it as well as I could based around the learning outcomes, but I didn't anticipate that positive response from the students, and what they highlighted as the real sort of joy of safe space to learn, safe space to question each other, safe space to really justify and critically sort of interrogate each other almost within their peer groups. And that linking of the sort of pedagogy to have that curriculum and theory practice link as well, I think was really quite good for the students to be able to see how that could link through what they were learning in the curriculum into that practice learning environment. So yeah, they were the nice things that I think were positive from that student experience point of view, is that they could start to link things, build confidence in areas, have that safe space. They said they'd got time to reflect. Reflection was very much built into the process of a PEEP. So they said just have time to stop and think and reflect was really important in that consolidation and the metacognition of their learning, not just learning things, realizing how they've learned it and how it's going to impact on them moving forward as well.
Thanks. Yeah, reflection. I think reflection is one of the key points. You can, really reflect very, very deeply on particular, very small instances in practice. And if you can break that down, and really sort of draw out the learning from that, it's really valuable, isn't it? Anita, is there anything else that you want to add?
Yeah, I totally agree with that, Lisa. I think those are some great points to make. And I think probably for me, when you asked that question, Ruth, a little story came to mind of some students that we'd put together in the near peer. And, when we try new models with students, we often want to select our highest performing, most strong students, to ensure success, so to speak. But sometimes we're not in a position to do that, and that kind of happened in some of our peeps. So it was just to do with the timing or whatever. So we just had to go with who was available, and partly to do with location and geography and all those kinds of things. And there was a student who I'm sure, we had a lot of students on the peep, so it's not easy for them to be identified on the peep, sorry, on the near peer model. And there was a student who was not someone that you would necessarily have thought would have been a good lead senior student. That they had a lot of their own learning to consolidate. They struggled with the program, and we all thought, oh dear, is this a good idea to place this additional pressure on this student to be a senior student in the near peer program? And that student absolutely shone. They stepped right up to the challenge. They loved the responsibility of supporting a junior student and educating and helping them. They told me afterwards that they had been thinking about leaving actually the program, but this had completely transformed their experience. So the power sometimes of doing something new and learning in a different way. So this was a student who actually didn't find the one-to-one model very helpful for their learning style, but found, that old, because the near peer kind of comes from that medical see one, do one, teach one kind of idea. So a student who was able to see something, do it themselves, and then teach someone else to do it, found that a much more effective way to learn. And it's always stayed with me, just the way that student's face kind of transformed when I asked them how the near peer experience had gone for them, and really seeing that shift. Yeah, so just wanted
I think just to add as
that.
well to the point that I was making, the content of the PEEP we've found over the last few years is that student experience. All of our students would love to do paediatrics. All of our students would love to be able to do work in a secure unit. The PEEP allows every student to have that learning that otherwise we geographically or availability might not be able to offer all of our students. So there is an enhancement in the content that can be achieved through an online link to a placement area that otherwise all of the students would not get that opportunity to experience.
A really excellent point. Really excellent point. Well, I mean, I think the passion that you both show towards these models is truly evident, and I'm sure you'll be getting some contacts and be able to spread the word around these models as well. We've got 3 minutes left, and is there anybody in the audience that would like to ask one final question? No, I can't see any other questions. So I'd just like to draw this webinar to a close. I'd like to have a warm thank you to Professor Lisa Taylor. Thank you very much for your insights into PEEP. And thank you very much, Anita, for your insights into the near peer model. It's really shown how collaborative working can really support the student experience, even in times of adversity. And I hope that, the takeaway message is that, get in touch, give it a go. Peer-to-peer learning is something which can really enhance the student experience and increase placement capacity at the same time. So thank you very much, everybody. Thoroughly enjoyed your presentations, and they will be available on the YouTube channel, and anybody who is at the sessions will get access to the slide decks as well. So thank you. Good afternoon, everybody.
Thank you.
Thank you very much, Ruth. Thanks all.
Bye.